Konyruok koro limbo ne jogo makedo kod tuo mar nyarogno kalure kod okang' mokao kod kar thieth ma mbalariany mar timo nonro gi chiwo thieth ma Kenyatta komakore kod jochiw thieth molony e wilo nyarogno mawuok e piny India kod UK mar gero senta mar wilo ne jotuo nyarogno. Millicent Adhiambo miyo waler mathoth.
Kalure kod jatend kar yudo thiethno Ahmed Dagane olero ni gisechako tiego lakteche mapacho ka e pinje maoko kaka India mondo giyud lony mar biro wilo ne jotuo nyarogno ka gedo mar senta no obiro rumo.
We have a partnership with leading hospitals in the UK and also in India, and we have sent some specialists to India for training, and the idea is once they come back we're going to establish that transplant clinic and the transplant unit itself so that we are able to do transplant. And so that's an area that we haven't started, but we're very keen in the next, in the future to be able to establish those services that are not available.
Kanegiloso enyasi mar chiwo thieth manono e kar yudo thiethno, jakom bod mar osiptalno Olive Mugenda oyango ni osiptalno dwaro medo masinde 20 e wi 35 mamoko mondo kony e chulo thieth mar nyarogno kalure kod dwaro mamalo mar menyo tuono.
We are also expanding the number of dialysis being done. We recently bought 20 more dialysis machines. So right now we have 35 of them, because if now you are at that stage of having dialysis, then it must be done. And you know, once it's not done once a week, it's done maybe 2 to 3 times a week. So we have now 35 machines, and our plan is to even expand this more, so that we have maybe even 50. What I can say is that, you see, the dialysis is not what is required in the end, because you don't want to do dialysis for life. So the transplant, the kidney transplant, is the end requirement, and the plan is in the next 6 months we actually start the kidney transplant, because anybody with a kidney problem, the dialysis is a stopgap measure. What you need eventually is maybe new kidneys, and we are going to get to that. Then at least we are able to improve the quality of life.
Egijiwo ganda jo Kenya mondo ritre kaka yorno mar gengo kendo bedo mabor kod tuo mar nyarogno, ka giwacho ni kwano ganda mayudo kod tuono osedhi malo ahinya ka moko to chopo ka tuono osemerogi.
The cases of kidney diseases that we are receiving here, I would say they are spectrum of all the cases, but the majority are the most severe cases. The reason why that has happened, we think there are a lot of factors. Some of them is lack of education and understanding. So people are not seeking health services and reviews when the problem is early. People should go for screening. And screening is like the activity that we are doing here. Screening is appreciating that sometimes the kidney problem may not have so many symptoms, especially when it is beginning. So people who are at risk of kidney diseases, then we advise them to go for the screening.
Genuniti ni gedo mar center marwilo nyarogno ne jotuo mbalariany ma Kenyatta University Teaching Research and Referral Hospital pachoka dhikelo fungruok ne jotuo makwan gi thoth matuono osechando kuom kinde ka gitiyo gomenda modhuro e hao thieth e pinje maoko. Millicent Adhiambo, Ramogi TV.